why we're here?
No,
No one knows why we're here?
we have no idea.
All right, well, the Frankford Emergency Department is the Daisy Team Award winner. You too, come here.
Thank you.
I cannot imagine a more deserving group than you guys. Seriously. You can? Except for you. Are you really going to sit in that little corner like this with all these people around you and make snide comments?
I'm getting
This is a bad, that's right, tell them. Well, I'm going to read this to you. I know some of you want to get on the road, but you were nominated by your leadership team because they get to bear witness every day of what you guys do. And I think they described it really well. So I'll read this. The emergency room staff at Frankfurt are like no other. And their team approach, dedication, and compassion make them stand above the rest. For this reason and many others, we would like to nominate them for the Daisy Team Award. And obviously you were chosen by your peers for this. The emergency department's caregivers understand the value of collaboration and embrace it. Nobody is alone, no matter how the day is going. The nursing staff work as a team to care for all the patients, whether they come in through the walk-in entrance or the ambulance bay, where many patients arrive with police and fire rescue. RED spans the entire city block, and on a daily basis, our nurses and staff provide attention to patients with an array of chief complaints, ranging in age from the very young to the very old and everything in between. The group of nurses and staff has been able to shine regardless of the post-COVID effects of all the amount of newly licensed nurses as well as nursing turnover that we have endured the last few years, and the ingenious methods of educating all of us post-pandemic. Their work ethic at the bedside outperforms, and we, despite the nursing shortage, have been able to staff better than most. They accept it and work smart together as a team. The team may not be as large as on some days, but they always persevere. High staff satisfaction ratings and their continued attendance to the patients is evidence that the team has remained positive despite the many challenges. We have been present for numerous occasions when a new life has been brought into the world and sometimes when lives leave this world. The beauty of a healthy newborn or the uncertainties of a premature birth, whatever they may face, they face it together. The team dynamics are centered around the various patients we see. Trauma patients who require multiple hands to stabilize them before transfer to its trauma-designated hospital, especially when multiple arrive at one time. Our staff's handling during such situations has been highly praised and recognized. Despite the fact that nursing leadership has changed over the past years, testimonials from patients, families, staff members, and leaders about the staff's bravery and fortitude make us feel honored to be in charge of such an incredible group of people. Additionally, this team fundraises and contributes annually to the Karen Smith Scholarship Fund, which supports nursing education for ER nurses, giving back to the public through farming out front in the community garden, and organizing clothing drives are just a few of the reasons this team is extraordinary. Their ability to rise to the occasion and tackle any issue is why we believe this unit is deserving of the Daisy Team Award. And you guys were nominated by Melissa and Kim. Congratulations. There aren't enough words, but I think they did a great job of really describing just how well you guys work together under difficult circumstances. You know, it's difficult everywhere. Here, especially some days, I know that you guys are challenged differently than many others are, but I think their words are just incredible in describing how you guys really do come together, how you work together, how you stay focused on what's important, which is each other and the patients you care for, and you don't get distracted by all the other noise sometimes. And I think that really is what makes you so successful and so good as a team and being able to function that way. So it is an absolute honor to be with you guys this morning. I'm sorry I was a little late. But it really is, I can't say enough. When I saw that you guys were the winner of this, we couldn't wait to get here to give it to you because it really is just so incredibly well deserved. So congratulations, and please know you have all of our gratitude for all you do every day. Thank you, guys. Well deserved.
Thanks so
Well
much.
deserved. Well deserved. So, one of the things, and we talked about it, quickly out there when you guys got the award, is I think this department is so unique in that you guys are such a cohesive team. You really are, and you can feel it when you come in the department. You can see it when you're interacting with patients, when you're talking to each other, when you interact with each other. How do you, and I'm going to ask each of you to sort of comment on this. This is a really, you have incredibly difficult jobs. That does not escape anyone how difficult it is to be an ER nurse now, let alone an ER nurse here at Frankfurt, where you're really sitting in a very impoverished neighborhood with people who are really challenged in so many ways. So. I know what it can be like here some days for all of you. So what is it about this ER that has kept all of you? When you just hear about it, I mean, I've called you a newbie, and you've been here for 7 years. So it's, what is it about the work environment? What is it about this team that resonates for you or makes you feel good about coming to work every day? I'll start with you.
Okay. So I think that part of the reason why I love to come here, I'll come to work every day, is because we really truly are a family. I see you guys more than I see my own family. And so 12 hours a day, 3 times a day, and more if you're picking up overtime, you come to know the people you work with, and they become your family, and then it's like there's so much teamwork. You never feel alone. Even if you're overburdened, they're like, do you need anything? Everyone's always willing to lend a hand, even if their assignment is hard. And it helps to take the burden off of you. And then you can, in turn, when you have a time, for yourself, you can, in turn, help. And I think that's what we do for each other. We help each other.
That's great. What would you say, Mike?
I would say that one of the biggest cliches in medicine right now is the cliche of healthcare team. I don't think I've seen it anywhere more than this group of people right here. I mean, it really is a team between the doctors, the nurses, the techs, and the most important, the unit clerks, I think. Everybody has a role, everyone plays a position, and they play it well. And like Katrina said, I'd like to piggyback on that. If not everybody can handle everything all the time, there's always somebody here that has your back.
So that's a great point, because it sounds like you guys don't have that expectation of each other. Right? Like you don't have the expectation that everybody can do everything, that you work to each other's strengths and you know them.
Nobody here is Florence Nightingale. Nobody can do it all the time.
Nobody's ever been since.
And somebody have your back.
Yeah. That's important though.
I don't want Lawrence Nightingale in my case.
I love that. You just gave me so much material, Mike.
I'm here for it.
No, I think your point is incredibly important though, because I don't think everyone recognizes that, and I think sometimes teams or people have that expectation of, oh, what do you mean you can't handle this, or you can't do this, or you're having a bad day, and they feel burdened by it, or they feel entitled, as you were saying earlier. I think when you have a team like you just described this team as, that's huge, and it's not to be taken for granted, because I think it doesn't exist in a lot of places. And I'm telling you, when you walk in this department, you can absolutely feel it. Yeah. On your worst day, it can be chaotic as all get out here. You can still get that sense from everybody you run into. What would you guys say?
I have to say the same thing that Katrina says. It is like family. It's like brothers and sisters, that we have our bad days, we fight, but we still all pull together no matter what, and that we all have each other's back, and humor gets us through too. So thank God we have Mike. I've been here since '98, and I have worked at Tarsdale, I've worked at Bucks, and I've always come back here because this is home. It feels like home.
I've been asked this question numerous times because I live close to Tarsdale, and they're like, why are you going down to Frankfurt? And I said, you just don't understand. I said, it's the teamwork down there. And from day one, when I first started as a medical assistant, I came here to do my internship, my externship, and everybody took me in like their little sister, and they encouraged me to go back to school, which I did, and I pursued my nursing career. And all through school, like everything, everybody was always right there for me. And then later on in life, I became charge nurse, and these guys are just wonderful. And I couldn't do my job without their work.
Mm-hmm.
Because they work so well together, and I never have to worry about anybody drowning, because they will not let that happen. Everybody helps each other, and it's just such a great team, and we've always been that way at Frankfurt. I mean, I've been through hundreds of employees, and it's just like the same teamwork.
But it doesn't happen by accident. You know, it doesn't. It speaks to you. It speaks to this team. And I think, you know, Di, you've been here for a long time on and off in other places as well. What do you think, if you had to describe what's different about this campus as opposed to other work environments you've been in, what do you think is at that essence of that?
I think at the core of this team is maybe just like admiration of each other, that they really just admire each other and they respect why we're here, right? And what we're here to do. And it, like you said, it's really not easy to do. And, you know, it's infectious. So each person infects the other person and how they and they feed off of each other. And I think that continues year after year after year. So as people come and go and come back, right? So most of us have been here and come back at some point. It continues. Yeah.
I love that. I think that's an important piece of it, because there's so much that you can control. I like what you said, Mike, about, you know, the cliche of a healthcare team, or, you know, and I think it does get overused or minimized in what is really a team and what's really not, or what's a good team versus a bad team, or a functional team versus a stinky team, or Philadelphia is well versed in probably that.
It's, you know, it's pretty funny how far some of us come to work here. Some of us come from a really, I mean, we worked at other places much closer to our homes, but we come specifically to work here.
Yep.
It's also very important to note that during COVID, we had a lot of travel nurses. They always extended.
Yeah.
And they always wanted to extend. And we asked them why. Why do you like this campus as opposed to another campus or another hospital altogether? They said the dynamic is so different here.
The teamwork.
Like,
that we
everyone is so
That's true.
approachable. Even the doctors, they're like, oh, at other places they're arrogant. But here, you can ask them for something and not feel bad about it. And everyone works so well together.
Well, and I will tell you, one of the things, and I think it's one of the reasons that I am just so happy for all of you guys that you are the first pathway designated hospital in the Northeast, is because of that. I think what happens, and I think sometimes I worry that people take it for granted here, that it is unique and it is not common. Like, you just don't find it everywhere for a million different reasons. But you're right. I spoke to a travel nurse not that long ago who, you know, was saying they were going to a new assignment at somewhere else. I was like in California or something. And she said, but you know what? I would totally come back here. So if you have California, or you can work at Frankfurt, right? I mean, right? I mean, come on. But what does that tell you? It's the sun under the L, right?
Yeah.
You could have the sun under the L, or you could have the sun in Malibu. What would you choose? But it speaks to that, and it does. It extends outside of, you know, you all that have been here. You know, people who come in as new people and get to practice here appreciate what a great environment that is. So what would you guys say, or what advice would you give, or, you know, how would you help other teams who are similarly challenged, or maybe even less challenged, but have a harder time being a team? What would you say to them in terms of how they could have what you have? Because I do think it's unique, and I don't see it many places. And I travel around a lot, and I get to see a lot of places, but I think there is something special about this department. You know, if you could kind of teach the class to another emergency department that's struggling with all the things you just talked about that they don't have, how would you tell them to start? Like, where would you tell them to start?
Don't take yourself too seriously.
Be a
What
little
about you?
humble. Be a little humble. Nobody was born with knowledge.
Yeah.
Everyone started at day one. You all had a day one. So don't come across like you're a know-it-all.
Like arrogant.
Yeah.
Like, don't come off as arrogant, because there's always something that I don't know. We're always learning.
Yeah, always.
And so, like,
Everybody.
always ask questions.
And we're never afraid to ask.
Right.
Which is
Always
important.
ask questions.
And rely on each other.
To
Something
help
you
each
learn every
other.
day.
Just help each other.
So on your worst day, on the worst day where, like, it just feels awful, like, how do you do that? Like, so when it really feels bad here, there's 10 people are sick and didn't make it in that day, and you're short, and,
Or you're
you know,
getting 10 rescues at once.
everybody, right, I was just going to say, and the ambulances just keep coming, and the waiting room's full, and people are, yelling, and like, how do you maintain that cohesion? Like, how do you then say, all right, guys, it's us today? Like, how do you do that in the face of that? Because I know you have days like that, probably more than any of us would like, but how do you maintain that?
Focus one patient at a time, because you can't be,
So don't look at everything, stay.
yeah, you can't be everywhere at once. So one person at a time, and prioritize. Okay, this is the sickest patient right now. How can we come together to do it like an assembly line? Like, let's get this done, this done, this done, this done.
And how do you keep a good attitude in that? Like, how do you keep what you guys
I'm
described?
always smiling.
That's easy for you?
Yeah, I wake up like this, okay?
We need to bottle you.
That's when humor comes in. We
Yeah,
just
it's
kind of
incorporating
lift each
humor.
other up and laugh because we nothing else to do but cry.
That's why they say we have dark humor.
Yeah.
Well, for sure.
Because
Yeah.
you don't want to cry, you gotta laugh.
Yeah.
So yeah.
There's a saying, I'm not going to get it right, but it's, your reality is 10% what happens to you and 90% how you handle that. I mean, I think that's what you guys are describing. Like, there's 10% that can be great and it can be the worst, but I think you guys are able to take that 90% and really make it work for you in a way that I think is sometimes hard for people. All right. What would you say is, your absolute favorite part about being here, other than being a part of a team? Like, what would you say is your favorite part about the Frankford Emergency Department for all these years?
It's definitely the people I work with makes it tolerable, makes a very hard job tolerable, and every so often I still get a kick out of making a difference in somebody else's life. I still get that.
I bet it's not every so often, Mike. I'm going to go out on a limb and say it's probably not every so often, but it's probably every day.
Yeah.
I bet you. I bet you. I bet you.
Yeah. I'll have to agree with Mike and also say that, like, when you're having the roughest day and that one patient goes, "Oh my God, thank you." I mean, this is a thankless job. And I don't have to have a thank you, but it brings you back and like, oh, this is why I do this.
Yeah.
It reminds you like, oh yeah, you're the reason why. Because they're usually mean. These patients are usually mean. But then you get that one patient that makes you remember why you even started this in the first place, and they're giving you a million thank yous, and you're like, oh, no problem, that's my job. And they're like, no, I will always remember you. And it's just, it's very...
People say thank you in all kinds of ways, right?
I have to say the same as Katrina.
Yeah.
That one patient that looks you in the eye and says thank you, and you know why you're here.
Yeah.
Different.
And the same here. I mean, when, like, if we have a trauma or whatever may happen, and I see the team in there and they're working so hard to, resuscitate somebody or whatever, and then when it does work, when they do come back, and I just look at everybody's face, and it's just so rewarding that this team just saved their lives, and it's just...
You guys do that every day, though.
Yeah.
You do.
And-
It's
and
not trite.
a new life coming in.
Yeah.
Like babies being born. It's just...
Yeah, we've been here to hug each other when a baby comes, and we've been here to hold each other when we lose somebody. So
Yeah.
it's just a good
And you
place.
guys are incredible in that space. And I think, again, you're kind of unsung in some ways and not in others. But I think I go back to this frequently, and I think about it. I don't know if many of you were here when the Amtrak derailment happened.
Oh, yeah.
Most of the patients from that derailment came here. This was the #1 ER where people came, and there was a patient who was incredibly critically ill who, came here first, was stable, I still use that word loosely, and then was transferred to the Penn system. And the next morning we got a call from that team to say, you guys essentially saved that life. Had that patient gone anywhere else, I don't think he would have been alive today. And I think, when I think of you guys, I think of that story all the time because I think it's exactly what you do every day. That was an extraordinary, dramatic situation.
We get those stories a lot.
That happens every day
We get
here.
those phone calls a lot from many other facilities who will kudos us
It's
you
the
know,
truth.
thank God they came to you guys.
It's
Yeah.
the truth, and I think it's important, and I love what I heard you guys talk about, and I would, challenge you to remember that piece of it too, because you should feel so incredibly proud of yourselves, both individually and as a group, because you do make a difference every day. You may not always know it, and the people who maybe feel mean or, aren't saying it or saying something completely contrary to that, I guarantee you, they're feeling it at some level too, and maybe when they walk away, they remember that. But they remember the kindness and the expertise that they get from all of you. Don't ever underestimate that. You guys are really, really incredible. And I'm so happy to be able to see you be honored this way, because I think it's incredibly well deserved. And, I think on behalf of all of us, you have our, eternal gratitude every day, because I do know, we all know that none of this work is easy, but when it's done well, as you guys do it, it can be really gratifying, and it's really nice to see a group of people, and especially, at least for me, a group of nurses that function the way you guys do. It makes it all worth it, right, at the end of the day. So, thank you.
Thank you.
Thumbs up. Everybody, thumbs up.